Well, beautiful skin doesn't have an expiration date. Here to show us how to make sure you have a glowing complexion no matter what your age is Dr. Stuart Kaplan. Good morning. Thank you for being here with us.
Good morning, Liberty. Thank you for having me.
So it's well known that youthful glow seems to fade as you age.
True.
2 questions. Why and how can we prevent that?
Well, we age in a lot of different ways. And when we're in our 20s, we're most concerned about prevention. Our face is really as perfect as it's going to be. Michaela here is in her 20s. Skin is perfect. The face is shaped like a diamond.
It really is perfect. How does she do that? Is it just sunscreen? What is it that you need to focus on in your 20s?
In your 20s, you want to use a product that has a good physical sunscreen, at least an SPF of 15. You also, in your 20s, start worrying about, you're entering the workforce, so women in their 20s start developing underarm sweating. You can use Botox to prevent that. Also, laser hair removal in the 20s is important because if you wait till your 30s and the hair starts turning gray, the laser won't work. So for hair, underarms, or bikini areas, 20s is a good time to start.
Okay, so what's a good regimen for someone in their 20s?
I would recommend a day cream that has a physical SPF, at least a 15.
Okay.
Use it every day. Also, something that nourishes the skin with organic ingredients and a good moisturizer.
And it's always important to take all that makeup off at night, correct?
You want to use a cleanser that removes all the makeup, but also a cleanser that's going to infuse the skin with good ingredients, one that has stem cells and other organic ingredients.
Okay, let's move down the line. We have someone in her 30s and then someone in her 40s. Let's talk about someone in their 30s. What do they need to focus on?
30s is, whereas 20s was prevention, 30s is maintenance. You're trying to maintain what you have. In our 30s, our face starts to lose that diamond shape. We get a little bit wider in the bottom half of the face, a little bit narrower in the top half of the face. But where women are most concerned, lips and eyes. Lips start to develop those fine lines. We can use plumpers. There are lip masks that are good at reducing those fine lines and wrinkles. You're going to look for an eye cream that's going to have soy and the peptides to prevent fine lines and creases.
Soy and peptides, okay.
And Botox is a good maintenance therapy to start because you want to prevent those creases from getting deeper and deeper. Just like when you exercise, repeated exercise gives you definition. Repeated exercising the muscles between the frown lines and the crow's feet will give you deeper lines.
Okay.
With Joanne, if you look, the beauty of doing Botox the right way is when she raises her forehead, her eyebrows move, but there are no creases.
I like that. She's beautiful. She's beautiful. Maybe I need a little bit of Botox myself. Let's talk about the 40s. What do you need to be mindful of when you're in your 40s?
40s is when you can really use the heavy hitters when it comes to lasers for reducing deeper lines and creases, pigmentation that may have gotten worse through the use of birth control pills or pregnancy. Melasma is a very common problem for women starting in their 30s and going into their 40s. So you want a prescription bleach cream. Also in the 40s, the face really develops more of that pyramid shape. So you want to revolumize. Products such as Sculptra and Radius are able to plump the face in the upper half so that you get that diamond shape again. Sclerotherapy for leg veins, also laser hair removal for hair on the chin and the upper lip. For the 40s, you want to use a serum.
You have products that can actually are for 40-year-olds, for 30-year-olds, and also for 20-year-olds?
That's absolutely correct.
Okay.
For the 40-year-old, you're going to want to use a serum that's going to have hyaluronic acid and is also going to have Juvinity, which is a Nobel Prize-winning ingredient that prolongs the life of the skin cell by prolonging the DNA. Also, in the 40s, you want to use, and also throughout, you want to use a product that protects the lip. Women often use glosses which amplify the sun damage. You want to use a gloss that has an SPF, that has stem cells, that has organic ingredients. In the 20s, you might want to use a clear. In the 40s, you might want to use a colored one.
Okay, well, thank you so much, Dr. Stuart Kaplan, giving us some great things that I'm sure everyone could use. We'll have all the information on our website. Just go to KTLA.com for now.